17 healthcare practitioners participated in the study, from which 3 were gynecologist obstetricians, 1 was emergency department physician, and 13 were general practitioners, from which 2 were males and 15 were females. The mean age of the participants was approximately 46.1 years old. The mean years of practice were 16.6 years. Through the previously determined themes, categories were generated. So the knowledge theme covered what is violence, identification of violent cases, commonality of the issue categories. From the attitude theme, the study team was able to generate perception on healthcare professionals of IPV, healthcare specialists' role in solution of the issue categories. In the practice theme includes asking patient about IPV steps against IPV and skills and trainings. These were the categories. Barriers and facilitators theme includes barriers, facilitators in asking and supporting categories. And finally, the last theme was providers' recommendations, from which we generated future interventions category. Most of the participants was able to identify 2 to 3 types of violence, and the most common answers to these were physical, mental, and sexual assault. The participant defined domestic violence as an act against human rights or everything what might offend the human. One of the participants mentioned that I understand as a step which is against the rights or wishes of a human being. Another participant told that it is not only physical but also psychological. They suppress so much, starting from the basic tease, which they call a joke, finishing with full psychological suppression, like who are you or what are you. The participant mentioned that they are able to identify the victim, and the identification, they mentioned that their identification is with the help of a number of signs. The study group divided these signs into 2 main subcategories, which were the physical signs and non-physical signs. Scrapes, bruises, injuries, and the rupture of reproductive organs, black eye, and bruises were mentioned as physical signs. So scrapes, one of the participants told that scrapes, bruises, injuries, why not the rupture of reproductive organs? Those are the main. Patients' behavior, such as not talking, looking only to one point, being frightened, and complaints, looks, and appearance was mentioned as the main non-physical signs which can lead to identification of the victim. The participant told that she didn't speak, she didn't answer her mother's questions. I felt awfully drawn, depressive, stressed. I thought to myself that there is something wrong with her. Healthcare specialists' perception on their role was limited only to talking or giving advice, and majority of the participants mentioned that there should be nobody involved in the solution of the issue besides the partners themselves. Only after asking if there should be any specialist help in the solution of the issue, some of the participants mentioned that probably the help of the psychologist may be needed. The participant told that there are types of relationship, especially husband-wife relations, where nobody has right to intervene, just 2 of them will decide what they need. And another one told that psychologists help because it is a stress that person needs to get out from that condition, understand that their life is still continuing. As the healthcare providers didn't see their role in addressing of this issue, the most common step which they were practicing in against IPV was the referral of the victim to the police and reporting about violence. Another very common answer was the referral of the victim to the psychologist, but this option was not was realistic because they were mentioning that they probably would do that. Advising and talking was another very common step implemented by the participants against IPV. And only after probing, some of the participants mentioned that they might refer the victim to the NGO. One of the participants told that I think the doctor's responsibility is to report to legal entities, as concealing the violence is also a delict. Another one told that nothing else, with the help of advice only, no other ways. Moreover, we are not specialists for that. The participants identified barriers which challenge their asking question to the potential victim and providing support to her. So the most common barriers mentioned by the participants was the inner closed status and women's unwillingness to answer the questions. Also, mostly emergency department physician and gynecologist obstetricians mentioned that presence of the husband or the relative is a very common barrier in their practice, because very often husband and relatives are coming with the woman to the checkups or visits, and that makes the women to not to spoke and be close during the ask question sessions. Also, women may not trust the physician. This was mainly mentioned by the GPs, because they were explaining this answer because they were serving to a big population of people, and the people there have the tendency to know each other. So the women were afraid that the physician may become the source of information for the neighborhood about their violent status. Women's fear is the biggest challenge. This was mentioned approximately from all of the participants, and it was explained when by the women's fears towards the husband, because maybe she will not disclose or maybe she will not refer to the NGO, probably because of that in the future husband may behave himself worse. The participant told that you try to ask a question, but she does not answer, very incoherent answers, as if she's afraid to tell something more than needed. Another participant told, I think in most of the cases the fear can be a barrier for the victim of the violence, that her husband can behave himself worse if she goes to any NGO or if she just discloses that issue. Besides from the barriers, there were also facilitators mentioned. And among the most common facilitators, trust and respect towards the physician, long-term relations between patient and physician were mentioned. The participant told that the trust and respect towards each other, if the patient understands that she visits the doctor for a specific help, it really helps. The patient should be honest with us for sure. They need to be straightforward and clear, tell us the truth. So based on the results of the study, we were able to identify the main findings which are that physicians are able to define and describe several types of domestic violence, and the identification of the victim is based on physical and non-physical signs. But after identification, most of the practitioners didn't know what they should do because of the they didn't. Their perception of their role is very limited, and this is also because of the lack of skills and practice and knowledge. So because all of these components, most of the IPV cases are staying unaddressed. So the main barriers which were mentioned by the participants were the lack of trust towards physician, women's fear from the husband partner, women's wish to conceal IPV, presence of the husband or relatives, and the most main facilitator for physician to ask or support women with IPV was the trust, respect towards physician, long-term relations with physician, and women's wish to disclose. The study has several strengths. So this was the first study which was conducted with healthcare providers in the field of IPV in Armenia. Interviews were conducted in a familiar environment, which led to the more open discussion. And the maintenance of rigor was done through credibility, trustworthiness, and conformability. The limitation of the study was that it covers only Yerevan, and there is no information about rural areas or other cities of Armenia. Based on the result, there are several recommendations with which the study team came up. So there are trainings on domestic violence for physicians, more active work of NGOs in healthcare sector, public awareness campaigns on domestic violence, and the new study to explore the same objectives covering both urban and rural areas. Thank you. Any questions?
Thank you, Zarihi. I have a question about the. You mentioned that the healthcare providers, they lack certain skills to identify or to refer women to certain facilities. And you also mentioned that they need to have a training on domestic violence. So what should be included in those trainings?
The recommendation itself, when writing this recommendation, we were thinking that independently from the specialization, all of the health providers should be trained in this topic, so that they can identify, and this identification should not be based on knowledge gathered through other sources, but it should be combined and organized knowledge which they will get from the medical schools. And after identification, the skills to deal with that issue with the cases of IPV. So that those skills are also need to be taught in the medical schools.
So what are the skills that are needed for the referral of the patients to police, for example?
First of all, they need to understand that only referring to the police is not the step they can do. They need to perceive themselves as the biggest issue here was that they didn't perceive themselves as a problem solver. So first of all, they need to understand that they are able to solve this issue, maybe through consultations, which were they doing not in an appropriate way, because most of the participants mentioned that they are asking the participant to forgive their husbands, but not to address somehow the issue.
Okay, this is what I'm leading to. So perhaps it's not the issue of skills, but changing their attitude so that they like perceive that they can do something and they have to do something in this issue. I have another question. Have you noticed any differences between male and female respondents in their answers?
Not really. Sometimes female were more marginal when talking about domestic violence. Even there were cases when female participants mentioned that it's not even a violence, but it's a type of strictness which is very common to our nation, and it should be in every family, and probably it will help the woman to be more organized and self-confident in the future.
Okay, and my next question is about the vignettes that you used. Since we don't use it, we use it rarely, it would be interesting to, if you could share with us an example of a question and maybe the most interesting responses that you were able to obtain to a certain vignette question. Thank you.
There were 3 vignettes, and one of them was about a woman who was about 45 years old, and she was vice principal in the school, but after the marriage, her husband asked her to leave the job, and thus she lost her friends, her career, and she was not